Okay, that's preparing the live stream. What have we got in the chat? June, July, June, June, July, June. Okay, so about a month, a few weeks. Mohammed's taking it in August, no problem. Okay, cool. We're on YouTube Live, that's good. What I'm going to do, for some reason, when I do these live streams, if you're in the Zoom webinar, registered and you're in the Zoom webinar, if the screen looks blurry, or it's not formatting on your computer properly, you're going to have to watch this on YouTube Live rather than watch it in the Zoom chat, in the Zoom room. I don't know why, it's just the way it is. So let me copy this and let me paste it into the chat for those of you in the Zoom who need to view it there. I'm gonna paste it in now. Or you can just go to YouTube Live if the screen looks blurry and just type in OET and you should see the live stream, okay? All right, so we've got 22 people in the Zoom. We've got 50 people on YouTube Live. That's cool. Okay. Nice, 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 nice. Good. All right, let's get started. Let me just get my slides ready. Cool. They're looking good. All right, let me just change the title of that. Okie dokie, I think that should be good. Cool, that's all working. Hello, everybody. My name is Jay. I'm one of the OET experts here at E2 Language. In this live class, we're going to focus on writing, OET writing. It's going to be for, well, the case notes that we're going to look at are specifically for doctors. However, if you're a nurse or a physio or whatever other of the 12 professions, I want you to try to attempt this as well, because it will still be good practice. What we're going to focus on specifically is, let me go back and let me just say this. What we're going to focus on specifically in this live class is organization, okay? On test day, one of the hardest things you need to do is to decide how to organize your paragraphs, how to organize the case notes into paragraphs, and then how to organize the paragraphs themselves. It's a tricky thing to do under timed conditions. It's fine if you got all afternoon to write the letter and to move stuff around, but you can't. You have to make these decisions in your head before you start writing. So, as you probably or hopefully know by now, there is a method to OET writing, which is this. First, you have to read the task, because the task tells you important information, such as, let me get my pen here, such as who you're writing to, why you're writing to them, whether the patient knows the doctor or not, etc. Then you have to go to the case notes and you need to interpret the case notes, because they're written in such a way that they're confusing, or they're short, or they're abbreviated, or they're symbols. Then what you do is you need to select case notes that are relevant to the task, to the reader, to the request. Then you will organize your case notes. This is what we're going to focus on today. And finally, you transform them and organize them together into correct English. Now, this method applies for all professions. So it doesn't matter if you're a nurse, doctor, dentist, whatever. This method applies to everybody, because everybody has the same criteria. The way that the examiners mark your writing is the same for every profession, okay? It doesn't change. So let's have a look at this. We're going to look at how to organize. Before I do that, let me check that everything's fine. Everything's fine. So let's talk about organization of case notes. Here's the first main structure. This is the first of two possible structures I'm going to show you. This one we'll call the main medical issue, and it works like this. In your introductory paragraph or your introductory sentence, you're going to outline the main medical issue. This is your intro, right? You're going to say something like, I'm writing to refer patient X into your care who requires ... Right? Then in the second paragraph, you're going to talk about, hang on, no, I've done this incorrectly. Just give me a second here. I'm missing something. Just give me 1 second to fix this. Done. Just let me check my other one. Yeah, okay, this is better. There we go, editing on the fly. Cool, now let me explain this. So you have your introductory paragraph. I'm writing to refer patient X into your care because of X. Let's say X is the main medical issue. Then in your first major paragraph under the intro, you will outline the main medical issue, X, in more detail. But there will also probably be a secondary issue. Let's call that Y. And so you will probably write a paragraph about Y. And then lastly, there might be some miscellaneous things from the discharge or the transfer or the referral, for example, that you might put into a single sentence or maybe a couple of sentences. And you'll finish with the request, which is something like this. So overall, it's going to look like this. I'm writing to refer patient because of X. Then you'll talk about X in more detail. Then you talk about Y and possibly some details of Z. Then you say, would you kindly ... Okay, so this is the first main structure. Let's look at the second type of structure. The second type of structure, and you'll definitely see these, I shouldn't say definitely, I've seen these, certainly seen these more in medical case notes where you need to write according to a chronology. So there are events that happen, there'll be specific dates. Also dentists will see this as well because the patient comes to you, sees you again, 3 weeks later they come back. And so you have these events and these dates. This is what we call chronology or time. So in that case, you will have your introductory paragraph where you say, I'm writing to refer the patient into your care because he requires this, X, of which you will outline in more detail. Then you will talk about the various visits. You talk about visit 1, visit 2, visit 3, before finally writing a paragraph about the request. Okay, so it might look something like this. I'm writing to refer patient because of X. Patient presented with X on this date. Patient then presented with Y on this date. And most recently, the patient presented with Z on this date as well. Would you kindly ... Now, it may not be X, Y, and Z. It may be presented with X again. And then it might be here, it may be presented with X plus Y, something like that, okay? Anyway, you see how you can set this out chronologically instead of main medical issue. So let's do some writing. I've got a task for you to do where we're going to put this into practice. Before we do that, just let me check that everything's okay on YouTube. Yep. Nice. We're going to look at a model letter in a second. And let me check that everything's okay in the Zoom webinar. Yep, cool. Let's continue on. So please read this task. I'll give you 20 seconds. Okay, let's break this down. So this is the most important part of the case notes. It's the task located at the bottom. It says using the information in the case notes. First of all, we know we're writing a referral letter, okay? 1, we're writing a referral letter for further investigation and definitive diagnosis. So let's call that the type of letter, T for type. Here we have the reason why. So we have the reason why for further investigation and definitive diagnosis. Here we have who we're writing to, the gastroenterologist, and that's what we need to know, the task, why we're writing, and who we're writing to, okay? Because that will dictate the selection choices we make in the case notes. Now, what I'm going to get you to do, because I can't just give you the case notes where you can look at them because we're doing this on the computer, what I'm going to do is I'm going to show you the case notes. I'll give you time. You need a pen and paper. So grab a sheet of paper, grab a pen, because what you're going to do is you're going to look at the case notes, a section of the case notes for like 2 minutes. You're going to note down relevant case notes according to that task. Then at the end, you should have a list of all the relevant case notes, of which I'll give you 20 minutes to write the body paragraphs of your letter, okay? That's the plan. So you'll need a pen and paper and I'll guide you through it. So let's do this. So I'm going to give you 60 seconds. Before I do that, just read the task one more time. Think about who you're writing to and why. Then I'm going to give you 60 seconds to note down the important case notes here. All right, your 60 seconds to note down important case notes starts now. Okay, that should be enough time. Hopefully you wrote down the relevant case notes. Let's do this section of the case notes now. It's the same task, of course. If you need time to read it one more time, I suggest you do so. I'll give you 10 seconds now to read this, then I'll hit the 60 seconds to start. Okay. Note down relevant case notes, please. Okay. Hopefully that was enough time to write down the relevant case notes according to the task, which is to write a letter to the gastroenterologist for further investigation and definitive diagnosis. We don't know what the issue is yet. Here we go. This one, I might give you 2 minutes. We'll see how we go. It's the same task. I'll give you a bit more time for this one, just to think, another 30 seconds. All right, that should be enough time. Of course, you're disregarding a lot of case notes. There's a lot of case notes here that are irrelevant to what we're doing. We're writing to a gastroenterologist. Would the gastroenterologist, for example, care about the whiplash injury that happened nearly 30 years ago? No. Would the gastroenterologist care about childhood asthma or a tonsillectomy in 1975? No. We're leaving out a lot of these case notes because they're just simply not relevant to who we're writing to, okay? Let's try this one. This time you'll have 2 minutes because now it starts to become much more relevant because we've moved into a time period that is closer to now. And again, the reason why we're writing is for further investigation and definitive diagnosis. So far, we don't know for what. Okay, hopefully you wrote down relevant case notes because now we have the reason for writing there. Can you see the reason for writing? Well, it's the provisional diagnosis, right? The reflux and the stricture. And it says there, right down the bottom, the plan, refer gastroenterologist for opinion and endoscopy if required. So we know why we're writing. And we can see a lot of the things that happened on that particular visit, which a lot of these would be relevant, which I'll show you in a second in the model letter, which I'm going to show you. First things first, we're now going to write. We're not going to write the entire letter though. I'm just going to get you to write a section. Don't write the date. Don't write the name of the doctor. Don't write any of this stuff. All I want you to write are these paragraphs here. So we want to have the introduction where we outline the main medical issue, the reason for writing. In paragraph 1, we're going to use the first structure we looked at, by the way. Paragraph 1, we're going to outline that main medical issue, the reflux and the stricture, in more detail. And I suspect that most of the information for paragraph 1 will come from that visit, that recent visit by Anne Hall. I don't think we've said, oh, her name's Anne Hall, by the way. This is the patient. Maybe you'll write paragraph 2 with some other relevant information, or maybe you'll go skip it and you go straight to the request or the ask here. Because remember, we're writing for further investigation and definitive diagnosis. Anyway, I'm going to give you 20 minutes to write this section of the letter, which is, by the way, once you know how to format the letter, once you know that the date goes here, then the name of the doctor or the person, the title of their job, the hospital name, dear Dr. X, regarding patient Y, date of birth, yours sincerely. Once you know how to do that formatting stuff, that's automatic. That should just come to you and you just go tuck, 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 tuck. The writing part are the parts that I'm just showing you here, the parts in bold, the introductory sentence, the first paragraph, the second paragraph, and the request. This is where you actually get graded on. You get graded for format to a degree, but the examiners are interested in those paragraphs there, the body paragraphs. That's what it's all about. And that's what you should be spending your 40 minutes writing. I'm going to give you 20 minutes to write it. Then I'm going to show you a model letter and you can compare your writing to the model letter, okay? All right, let me just check in on you guys to see if you're okay. How's it going? Hopefully you've been writing those paragraphs. Put them into the chat if you want, so I can have a look at them. I'll give you another 5 minutes to finish your writing. Hopefully that's enough time. Okay, somebody's asked about family history. Well, if it's relevant to the particular diagnosis, I think it would be relevant. There were a lot of irrelevant case notes in family history, so you'll need to be judicious in which ones you select. We'll look at the model letter in a sec. I'll give you another 5 minutes to finish up your paragraphs. All right, that should be enough time. Let's have a look here. Good. I'm not sure if that's enough time or not, but either way, you can go back at some point and rewrite it if you need to. So let's have a look at the sample answer, okay? Okay. Now we're going to focus on this part here. This is the part that I wanted you to write. I didn't want you to write any of this stuff. As I said, if you know how to construct your letters, this will all be automatic. But this part here is the hard part of the letter where you need to be, well, sort of creative. You need to organize it properly. You need to interpret it properly. Hopefully these are all relevant case notes, etc. So first of all, I want you to read through this and I want you to notice that there are a few mistakes in here, not grammatical mistakes. There are some mistakes in terms of irrelevant case notes, and there are some mistakes in terms of poorly organized paragraphs. So please tell me, read this and then tell me what you think are the mistakes, or think to yourself, what are the 3 mistakes here? Okay. If you look closely, if you read this, you'll notice that there's some wonky things going on. Let's have a look at it. Specifically, I've put in an irrelevant case note here, secondary school teacher. That's probably not relevant for the gastroenterologist, and that's a good thing. What about this? She has not smoked for the last 15 years. This is irrelevant. Why does the gastroenterologist need to know that she hasn't smoked for 15 years? If she has been smoking for 15 years, that would be relevant. What about she drinks socially, mainly spirits? Probably not relevant unless it said something about she drinks excessively, or she's an alcoholic, or something that is quite remarkable. That was unremarkable. The other thing is that we did not include these relevant case notes. She has no sensation of a lump in her throat, and nor is she overtly anxious. This related to this paragraph, which related to the main idea, so we should include it in here as well. Lastly, if we look at the request paragraph down here, the final paragraph, we did not say we also needed a definitive diagnosis. We finished it with, we're just asking for further investigation. But if you remember correctly from the task, it said that we wanted further investigation and a definitive diagnosis. So that needed to, go into the request paragraph. So let's read this now. I'm going to read it too. Just let me make sure that I've got the right slide here. Yes. So thank you for seeing Miss Hall, a 44-year-old who is presenting with a 2-week history of symptoms of dysphagia for solids, epigastric pain radiating posteriorly to T12 level, and concomitant weight loss. So we've put all of those pieces of the puzzle together into a single sentence. The symptoms follow a constant course. And now what we do is we're going to elaborate on these symptoms or on this main medical issue, okay? So this paragraph here is going to be all about these things here, in more detail. Ms. Hall believes the problem commenced after an upper respiratory tract infection 2 weeks ago, for which she self-prescribed an over-the-counter Chinese herbal product with unknown ingredients. However, she has also recently increased her coffee consumption and takes 2 to 3 aspirins a month. This would probably be irrelevant, to be honest, because it's just unremarkable. 2 to 3 times per month. Maybe it's relevant, we'll leave it. She has no sensation of a lump in her throat, and nor is she overtly anxious. For your interest, so now this paragraph here is an additional paragraph that may or may not be related to this one, but it's enough information that it warrants its own paragraph. For your interest, Miss Hall has a history of dyspepsia and dermatitis, for which she was prescribed oral and topical cortisone. There are no apparent signs of anxiety. She has a family history of peptic ulcer disease and is allergic to codeine. Her BMI is currently ... So somebody asked about family history and whether it's important. Well, this particular case note would be important. The peptic ulcer disease, again, we're writing to the gastroenterologist. That would be interesting to write. So that was the one case note from their family history that we took. Finally, in the request, it says, my provisional diagnosis at this point is gastroesophageal reflux with possible stricture. I'm therefore referring Ms. Hall to you for further investigation and a more definitive diagnosis. So that's, well, what did we look at? We looked at 2 possible structures for your writing. One is called the main medical issue structure, where in your introductory sentence, you say, I'm referring to this patient for this issue, this main issue. Then in the second paragraph, like we've done here, we outline that main medical issue, all of the details surrounding it in one clear, clean paragraph. The third paragraph might relate to a secondary issue, or it may just be a miscellaneous paragraph with some other important information that didn't quite fit into that second paragraph. Then we write a paragraph where we have a request, where we ask the person we're writing to do something for us. In this case, we said, listen, what I think the problem is this, but what I'm doing is referring this patient to you so you can tell me, give me a definitive diagnosis of the issue. So that's what we looked at as the first structure, and that's what we wrote in this one here. Hopefully your writing looks something similar. The second type of structure was called the chronology structure, where same thing, in your introduction, you outline the main medical issue. Second paragraph, you probably talk about the main medical issue in more detail, other case notes that are relevant. Then you start to outline what happened each time that patient visited your clinic. Upon first visit, this is what happened. On the second visit, this is what happened. Finally, on her most recent visit, this is what happened, right? And then you go into the request where you say, I'm writing to you for X, Y, and Z. Cool. Look, it's kind of complicated to explain like this. It's definitely something that you need to do. You need to write yourself. That's why I recommend you certainly do some preparation before test day. If you're unsure of where to go for good quality preparation materials, check out this website, www.e2language.com. We are an OET premium preparation provider. So we're one of the few in the world who know what we're talking about in detail. So if you need some help, check out that website. You can sign up for free. And if you want, you can upgrade your account to take some tutorials, get some writing feedback. go through all of the different methods lessons. There's lots and stuff on the website for you. At the moment, it's built for nurses specifically, but it's also applicable to doctors. We have 3 sets of case notes for doctors writing as well as 5 for nursing. Cool. I'll stick around for a little Q&A just for 10 minutes. So if you have any questions, pop them into the chat. Okay, Jay, do all of the letters use the same format? No, you need to be flexible. What I've given you is a basic structure, 2 basic structures. But of course, on test day, you don't know what the case notes are going to look like, and they will change each time. And so you need to be flexible. You need to think about, you're not writing to a structure. What you're doing and what you need to think about on test day is you're writing to a person. You're writing to a gastroenterologist. Put yourself in the shoes of the gastroenterologist. If you were the gastroenterologist, what do you need to know about this patient, about Anne Hall? You want to know this, you want to know this, you want to know this. You don't care about all of the rest. Then you write that to that person. So it's a very good idea on test day to think, okay, I'm writing to a physiotherapist. If I were the physiotherapist, what would I need to know about this patient? That's how you write the letter, not according to some set structure, okay? Jay, when I write about patient history, do I need to use past or present tense? I imagine it will be past tense because it's all happened in the past. For example, Miss Hall suffered from ... She had ... Be careful with verb tenses, though they can be tricky. Jay, what if we include some of the irrelevant case notes? Well, you will lose some points for including irrelevant case notes. What would be worse, though, is if you don't include relevant case notes. So if you miss some relevant case notes, that is worse than including some irrelevant case notes. So if you're unsure, include it, okay? But try to definitely don't include the ones that are definitely irrelevant. I missed the live. When will I be able to watch the recording? Nor if you're a paid member, you'll see this on the website. If you're not, unfortunately, you won't see it again. Okay. Oh, interesting. Okay, so Fazana Hussein's got an interesting point here. I think the drinking of the alcoholic spirits can bring about dyspeptic symptoms. Yeah, good idea. I think so too. Yeah. And it didn't say, did it? It said she drank spirits socially, but it didn't say how much. Maybe it would be a good idea. This is one of those case notes where you sort of think, oh, should I, shouldn't I? Include it if you're unsure. Good idea. I think that's a good point. Is it necessary to write date of birth immediately after introducing the patient regarding, yes. Yeah, so there's 2 ways to do that. So you say, dear Dr. So-and-so, full colon, Anne Hall, comma, 2 ways to do it. DOB, her date of birth, or aged 63. So 2 ways, both are fine. If it gives you the date of birth, just use the date of birth. If it gives you her age, use her age. Jay, is it necessary to write? Okay, I've answered that one. She is also allergic to dust mites and sulfur dioxide. Is that relevant in this case? I don't know. If you're writing to a pulmonologist, it would definitely be relevant, right? Can you please tell me where to put the date? Okay, I won't go into that. Is it right that 3 to 5 mistakes in writing will give me less than B? No, that's not true. Depends what the mistakes are. If they're just minor mistakes, that's not a problem. What will happen if I write less than 180 words? That will mean that you've probably left out relevant case notes. If your writing is those 3 or 4 paragraphs that I showed you, if that's under 180 words, it probably means that you've missed some relevant case notes. If it's a referral letter to an emergency room, which one comes first, the recent or the past history? Thank you. What do you think? Let's put ourselves in this situation. Okay, so you're referring a patient to an emergency ward. So let's say you're the recipient at the emergency ward. What do you want to know first? The patient's family history or the recent incident? Think about it. Answer that question. Someone write it into the comments. What do you think is the answer? Do you want to know the patient history first, or do you want to know the details of the recent incident if you're writing to the emergency ward? Yes, thank you, Narul. I totally agree. You want to know about the recent history first, the incident, what happened. You don't, like, the family history is important, but you need to prioritize the important information. You need to put that right at the top. You need to say, I'm referring this patient because of a head injury. And then in the first paragraph, you'll talk about the head injury because that's what the recipient wants to know about first. Then in the next paragraph, you might say, oh, by the way, in terms of family history, Jay, what happens if I don't write in complex sentences? That's okay, but you should try to include a few complex sentences. Yeah, good. Nice. Good. Jay, how will I know if I've written between 180 to 200 words? So you need to count the words in the body of the letter. So again, let me show you the body. So that's this part. Actually, it also includes this sentence down, this paragraph down here. It does not include any of this. It includes the introductory, the opening, these body paragraphs here. This is the body and not yours sincerely. So this part here should be between 180 and 200 words. May I know who will be marking our letter, an English teacher or a medical professional? It's actually an English teacher who is trained in medical English. Yeah. For doctor's case notes, is there a model letter available for comparison? This one I showed you today is a medical set of case notes. Okay. If there are more than one provisional diagnosis, how do we write it in one sentence? You don't necessarily have to write it in one sentence. You can say my provisional diagnosis is asthma or potentially a lung infection. Yeah, or you could do it like that. Jay, I will take my exam in June and I think I need help with writing. Is there enough time to take your writing course? Yes, you still have 2 weeks, so you can sign up today, click the upgrade button, and I would book your tutorials for early next week. That would be perfect, or you can take them the week after, but it gets busy in the busy week, okay? Cool. All right, guys, I might leave it there. Thank you very much for coming along. I hope it was somewhat helpful for you to learn about the two different structures and how to select case notes and how to structure up your writing. Hopefully you've learned something there that will help you to pass this test and move on. And yep, thank you again, and I hope to see you soon. Don't forget to subscribe if you're on YouTube. Click the subscribe button so you'll get notifications of when we're doing live stream classes. See you soon.